I do have a bit of an update in relation to Canberra Hospital, or particularly the Centenary Hospital for Women and Children. A baby in the special care nursery at the Centenary Hospital for Women and Children has tested positive to COVID-19 overnight. The patient has been in the special care nursery for some time and became symptomatic last night. The child has been moved to a COVID-19 ward and family members have been advised to get tested and to enter quarantine. Team members and other families who are assessed as either at high risk or moderate risk of exposure are also being contacted and advised to get tested and to quarantine. The CHS Canberra Health Services COVID exposure team is conducting a full risk assessment this morning. And we know that they have done this many times before. This will include liaising with the families of patients who may have been discharged from the special care nursery in recent days. CHS is liaising with ACT Health's public health team around potential related exposure sites outside of Canberra Health Services. Coordinating testing of patients, families and staff will continue today. Enhanced infection prevention and control measures and protocols have been put in place to further minimise any risk, and impacted areas, of course, are being deep cleaned. Canberrans can be assured that this situation is being expertly handled and they can absolutely feel safe again to attend hospital should they require that level of care. And again, this is something that our Canberra Hospital and Canberra Health Services team have done many times now, as we've seen positive cases of COVID-19 identified within the hospital setting. Some news on the ACT budget, which is of course being delivered today. Well, we're investing more funding through the 21-22 ACT budget to ensure we can continue the government's effective public health response as we move through the phases of the ACT's pathway forward. The ACT government is investing more than $90 million to continue the COVID-19 public health response and push forward with the vaccine rollout. Almost $65 million of this will be allocated to manage the impact of the virus on the ACT community and provide the Chief Health Officer the support she needs to continue her excellent advice and response to the pandemic. The ACT Hardship Fund has also been extended for 12 months to the 30th of June 2022 to ensure that Canberrans who are temporarily unable to work under a COVID-19 direction or health guidance are not left behind. Beyond this, a $500 million boost will be provided over 4 years in the 21-22 budget to enhance resourcing in response to growing demand for core services across the ACT public health system and to reflect the increased complexity of health service delivery. Our teams across the ACT government and in the community sector have been doing an incredible job responding to the pandemic, but we know that demand for new and expanded health services has only been increasing over recent years. We've worked extremely hard to get as many people vaccinated as possible and will continue the rollout until everyone in the ACT who wants to be vaccinated has the opportunity. We're providing extra funding for the ongoing COVID-19 response and vaccine rollout to protect our community and guide Canberra along the pathway out of the lockdown. But before I finish up today, and in the absence of the Chief Health Officer or her deputy, I'd like to give a shout out to the Digital Solutions Division of ACT Health. Throughout the pandemic, this team has risen to the challenge to put in place new technologies to support our COVID-19 response. They are the creators and developers of so many of the digital systems that have been critical to our success and that we rely on, including the Check in Canberra app, of course. They also run the MyDHR online booking system and the phone booking system for the COVID-19 vaccine program here in the ACT, which has seen thousands, hundreds of thousands of Canberrans booked for vaccinations. So thank you to all of the teams within the Digital Solutions Division who have contributed to this response. In summary, for those who joined late, Sadly, we have been notified of one death today, and again, our sympathies are with the families and friends of that individual. We have 28 new COVID-19 cases. 19 of these can be linked to known cases or ongoing clusters, and 9 are still being investigated. 11 were in quarantine during their whole infectious period. 5 people spent some time in the community for part or all of their infectious period and may present a risk of transmission to others. 16 people are in our hospitals, 7 in intensive care, and 4 requiring ventilation. So with that, I'm happy to take questions.
Minister, any further details on the COVID-positive baby? Is like their age, and is that the youngest person to test positive during the ACT's whole pandemic management?
I'm not sure if it's the youngest person to test positive. I might hand over to Mr. Peffer to provide a few more details, if that's okay.
Good morning, everyone. In terms of the age of the youngest positive case we've had here in Canberra, I don't believe it is. To provide actual details on that, that's not something I can do, just in terms of patient privacy and the family as well.
So we don't know the age of this?
Oh no, we certainly do know the age. We've been caring for that baby for a little while, but in terms of providing that level of detail today, I'm not in a position to do that.
Do we know how that baby was exposed to the virus within the specialist unit?
Look, the special care nursery is one of the few places in the hospital where we do have special visitation arrangements in place. We know that parents need to come in each day to potentially feed or provide that close care to their babies. And so at this stage we don't have a known source of transmission. That is something that the team's looking at very closely. We're working in partnership with Public Health, and we will look at that, I guess, in the coming days to identify that.
Are those visitations, is that likely to change given we've had this situation?
Yeah, so the way the special care nursery is set up at the moment, it's in a couple of parts, and so this hasn't impacted the whole nursery. Pleasingly, it's impacted a part of it, and that part of it we've now obviously ceased visitation. It's had a deep clean undertaken. The baby has been moved to the paediatric medical ward, which is one of our dedicated COVID wards at the hospital. But at this stage, there are still parents and loved ones visiting babies in the special care nursery, but not in the impacted area.
Can you provide any detail on whether the baby is particularly ill right now?
Look, that's not something I'll talk about today.
And how many staff will be affected?
So we're going through that at the moment. As the Minister said, we've got an excellent team who's done this now many times. In terms of their experience and qualifications, I'm very grateful we've got them as a part of our team at Canberra Health Services. They're working that through. We do know there have been a couple of medical officers who've been deemed close contacts at this stage. There will be a larger number than that in terms of nursing close contacts. We've also contacted all families who could potentially be impacted or consider contact and asked them to have testing undertaken. Those team members who have been impacted have all undergone testing at this point in time. And the risk assessment of the nursery also expands into some of those common areas that surround where people might be spending time. So that's all in flight at this point in time. It's an evolving situation. This is not something we've known about for very long, a number of hours at this stage.
Mr. Given the new child patient, and then that's not even the youngest that we've had, does that, I guess, ramp up perhaps conversations or the importance of getting the vaccine, tests and things approved for even younger than 12?
Yeah, so that's really obviously not something that's in the ACT government's control in any way. But obviously we're keeping a very close eye on what's happening around the world in terms of clinical trials and potential approvals for vaccinations for children under the age of 12. The last I saw, that really was focused on children from the age of 5 to 11. So I'm not aware that there's even any proposal at this point in time for a vaccine to be available in the short term, or even sort of short to medium term for children under the age of 5. So I think what that really points to is the importance of ensuring that children in our community who are not currently able to be vaccinated are surrounded as much as possible by adults who are vaccinated and older siblings who are vaccinated. That while being vaccinated doesn't completely remove the risk of getting the virus and transmitting it to another person, it does reduce that risk. Being less unwell and having less of that viral load reduces the risk of the transmission to another person. So this is a really important protection for children in our community. And it's really great to see that, obviously Canberrans have taken up vaccination in droves, and we're getting to that 95% rate.
So on those milestones, that's 95% pretty wild rate. Do you think we'd reach it perhaps this soon?
Look, I think there's been a bit of debate internally about 90, 95, where would we get to? I think we thought we would probably get to around 90%, maybe 92%. The fact that we've got to 95% of people aged 12 and over with our first dose vaccination, which means it's pretty likely that they'll get the second dose, is an outstanding outcome for our community. It is, it's really, really positive that Canberrans are not only protecting their own health, but looking after one another as well.
And when do you think we might hit that 70% double dose?
I don't know, in the next few days. So, to get to sort of 66%, it's going up at close to 1% a day. So do your calculations on the basis of that.
That 95%, do you expect now that the first doses will sort of peter out? Do you think that's sort of the highest that we'll get?
Yes, so I think getting further than that is a challenge, although we've seen in our older age groups that we have got to even higher rates. One of the things that I think the Chief Minister has touched on previously is what is the denominator? Are we using an accurate assessment of our overall ACT population and then the breakdown of the age groups within that? So we have done a bit of work with the Commonwealth to relook at the denominator for those calculations, because we were getting to the point where we were having more than 100% of our population in those older age groups being vaccinated, which clearly is not the case. So we've done a bit of work. So if you've seen a little bit of a flip down in the numbers, that would reflect that change in denominator.
The Chief Health Officer said yesterday that she wasn't really expecting to see numbers in the 20s again. So 28 today, is this another case where we shouldn't put too much stock in one number?
Yeah, look, I think it's a good sign that we've kind of come down to that high 20s, low 30s kind of plateau over this week. But our numbers, being small numbers, will continue to move around. I think one of the things that we need to bear in mind is we had those high days of 50, and we're still sort of seeing the outcome of those days where we had a lot of people unknowingly infectious in the community. Some people probably knowingly, but in any case, some of those risks of people having been in the community during their infectious period are still playing out. So I wouldn't be at all surprised to see our numbers go back up again, maybe come down again, go back up again. But I would suggest that this is probably the plateau that we're on. High 20s to 40s is probably the plateau that we're in at the moment.
Minister, you spoke yesterday about a proposed vaccine mandate for healthcare workers. Why was the disability sector not included in that mandate?
So there are a few issues around that. One of the factors that fed into the timing of our decision around mandatory vaccination for healthcare workers was the Australian Health Protection Principal Committee statement from the 1st of October. The AHPPC has considered potential to mandate vaccination for disability support workers as well, and this was expected to return to National Cabinet in late September, but AHPPC is still doing some more work in relation to this, and it's likely that that matter won't be considered by National Cabinet until November. There are some challenges associated with identifying the workforce in disability settings, and also creating a direction that could potentially relate to work that is undertaken in a person's home, just in terms of the way that the public health directions are crafted. So the ACT government has maintained, and I think I've said this publicly before, that the Commonwealth should be considering using its own regulatory power through the National Disability Insurance Scheme's worker screening process to include a requirement for workers to be vaccinated, particularly those who work in higher risk settings, particularly those residential disability settings. We recognise that that wouldn't capture all disability support workers, but it would cover workers who work in residential care settings, day programs and the like that are managed by registered providers under the NDIS. Unfortunately, the Commonwealth has steadfastly completely refused to even consider using its own regulatory power to take this step. So ACT officials are considering what options are available to us. Disability support work, as I've mentioned, is often provided in a person's private residential home, which presents some real challenges regarding the interference in the right of individuals to determine who visits their home. So I think there are some countervailing pressures. I know there's a lot of commentary from people with disability and their families and carers that they want to know that the worker that's coming into their home is vaccinated. But on the other hand, it's very hard for us to put in a mandate that says you are not allowed as an individual to choose to receive care from a person who is unvaccinated. That's quite a significant step for us to take. And in addition, I think what we would say and point out is while the risk of COVID-19 transmission is reduced in fully vaccinated people, as we've talked about, we know that even fully vaccinated disability support workers may become infected and may present a risk of transmitting the virus to the person that they're caring for because of that close contact. So alongside infection prevention and control measures, including appropriate use of PPE, the best protection for a person with a disability aged 12 and over is for them themselves to be vaccinated. And that's why the ACT government's key priority has been to ensure that people with disability have every opportunity to get vaccinated. And we've been extremely disappointed, as I've said before, in the Commonwealth's efforts in this regard, and concerned that the rates of vaccination for people in the disability community in the ACT continue to be below the broader community, while they're well above the national rate. So we'll continue to expand, we've continued to expand the number of appointments that are available at the Access and Sensory Clinic. We've conducted vaccination clinics at specialist schools, and we've worked with the Commonwealth and other partners to boost in-reach vaccination where that's the best option for people with disability. And we will continue to do that work around vaccination policy for disability support workers. But to be quite frank, public health directions are not a long-term solution to this problem. We know that COVID-19 is going to be with us for some time. We've talked about the fact that people under the age of 12 at the moment cannot be vaccinated. And so having the Commonwealth use its regulatory authority under the National Disability Insurance Scheme worker screening would be a big step forward, I think, in this debate, if they were at least willing to countenance doing that.
You mentioned yesterday that in further weeks and months the government would look at other sectors to perhaps a good mandate policy. Can you maybe list a couple of those?
So I think we were talking really about other healthcare sectors, and we've obviously seen commentary from the Royal Australian College of General Practice and the Australian Medical Association that they would like to see a wider group of healthcare workers. I think I've had some feedback as well in relation to allied health recently, and the AHPPC's statement that came out on Friday did talk about a very wide range of healthcare workers. So that discussion of the stepwise approach in vaccination was really related to this first phase of healthcare workers, which are around hospital, day surgeries and ambulance and hospice. And then we're looking at another stage of healthcare workers. But again, that's a little bit more complicated because these are sort of smaller, privately owned, potentially independent people, potentially again going and providing services in people's homes, that kind of thing. It's a little bit more complicated in terms of how we craft a public health direction. And I would just also say that in terms of general practice or any other employer in the health sector, it is open to them to require their own staff to be vaccinated.
Just another question on the disability sector. You said that the ACT will consider its own regulatory power. Do we have any sort of timeline, given that the sector itself is calling for this to happen now?
Yeah, look, we're actively considering what we should do and how we should do it. So I can't give you a firm timeline on that, and I think it is really disappointing that it hasn't been prioritised as an item for National Cabinet by the Prime Minister. He sets the agenda for National Cabinet. He hasn't asked AHPPC to bring this back. This reflects an ongoing attitude to supporting people with disability in response to the COVID-19 pandemic by the Commonwealth Government that is, continues to be extremely disappointing, where they are not taking up their responsibilities. They didn't take up their responsibility to get people who live in disability residential settings vaccinated early as part of Phase 1A, as they had said they would, and now they're putting this on the back burner in relation to their own responsibilities for disability worker screening.
About vaccination rates in the disability sector. Earlier this year, it was unclear what those numbers were because we couldn't get a straight answer from the federal government. Are you confident in the numbers that you have now? Can you give us some clarity around how many people are vaccinated in that space?
Yeah, so we have numbers that again relate to NDIS participants and staff. So for NDIS screened staff, and the fact that they can get this data highlights the fact they have the capacity to do this through NDIS, right? So dose 1 vaccinated as of the 30th of September, that's the latest data we got from the Commonwealth, is 82.2% and 73.1% fully vaccinated. For NDIS participants from 16 upwards, first dose 76.9% and fully vaccinated 59.6%. Pleasingly, in the ACT, for NDIS participants aged 12 to 15 years, the first dose is 62.2%, and of course fully vaccinated is only 12% because they've only been eligible for a relatively short period of time. So we can really see Canberrans with disability coming forward, wanting to get vaccinated. Our teams are working really, really hard to ensure that that's the case, including through our in-reach into specialist schools. But these numbers still sit behind the wider community, which is, really concerning. Okay, thank you very much.